Okay. All right. Thank you guys for coming to another one of our seminars. So today we've got Dr. Tom Baker. He is a senior lecturer in human geography and also associate editor of the International Journal of Housing Policy. His research examines the politics and practice of policymaking and the governance of socioeconomic marginality. And today what he'll be talking about is crowd-funded healthcare and the marketisation of that, and I think marketisation of healthcare in general. Yeah, I'll pass on to you.
Thank you. Kia ora koutou, nice to be here with you. Thanks for the invitation, Martin, and to the Compass team. I'm going to be speaking to this title, Getting the Crowd to Care, Marketing Illness Through Health-Related Crowdfunding in Aotearoa, New Zealand. And I'm really just here on behalf of several co-authors of this paper that was recently published in Environment and Planning, Economy and Space as part of a special issue on marketising social reproduction, one of the co-editors of, and that different papers are coming out slowly but surely related to that special issue. So my group of collaborators that I'm reporting back on behalf of Caitlin Newell-Kearns, who was a fantastic master's student of mine and Octavia's and Annie's while she was here at the University of Auckland, now works at Child Poverty Action Group doing wonderful things. Octavia Calder-Dorr, who was a critical health psychologist or critical psychologist that engages with issues around health at Victoria University Wellington. Anne E. Bartos, formerly of geography at the University of Auckland, now at Penn State in the US, and Susan Wardell, who's a social anthropologist at the University of Otago. And if you're interested in crowdfunding, medical crowdfunding, encourage you to look up Susan's name and webpage, because she was recently awarded a Marsden Fast Start to look at medical crowdfunding in Aotearoa New Zealand. And it was just through sort of happenstance that we connected with one another and were lucky enough to collaborate around this paper. But Susan's doing both more extensive quantitative work around crowdfunding practices in Aotearoa, but also more particular in-depth qualitative investigations of different dimensions of the use and experience of crowdfunding for health-related expenses. Enough of that. Tough guy faces hardest battle yet, reads the title of Levi Holly's crowdfunding campaign that you see here. Following a shock diagnosis with inoperable brain cancer in 2019, he's become, according to his campaign webpage, a man whose sole purpose is to survive. I'll use a lot of quotes in this, so I'll just go like that whenever I'm quoting someone else. As a normally healthy, fitness and sports-minded 44-year-old, Levi has always given his time and skills away freely, of being a regular at charity events, fundraising for a number of organizations, and more recently sponsoring amateur athletes. In light of Levi's commitment to various communities and causes, Hannah, Levi's campaign manager, but prior to that, best friend and caregiver, appeals it's time for us to come together and help this amazing man out. Levi's campaign, of course, is but a drop in the ocean of health-related crowdfunding appeals. As a growing practice internationally, personal health-related fundraising makes up the largest and fastest growing subset of donation-based crowdfunding. On GoFundMe, which is the world's largest platform for crowdfunding campaigns, personal health-related expenses now comprise the largest category. This global trend, of course, is reflected on Give a Little, which is our local version of GoFundMe. It's not run on a profit basis, but it does share many similarities with GoFundMe. Levi's campaign gained significant traction, raising over $33,000 in about 6 weeks, but not all campaigns experience these kind of successes. There are significant variations between the ability of campaigns to capture the hearts and ultimately the wallets of loved ones, acquaintances, and strangers. And while Levi's circumstances are undeniably life-threatening, the funds of the crowd, so to speak, are not necessarily distributed according to the degree of medical need, highlighting some of the challenges of the use of this particular phenomenon to fill gaps in publicly funded systems of healthcare provision. The growth of health-related crowdfunding, we would argue, stems from structural inequalities and resulting forms of lived precarity. But as we talk about in the paper, crowdfunding also amplifies those structural inequalities and forms of lived precarity. And as we'll go on to show in the paper and in the talk today, crowdfunding introduces additional axes of inequity, which result from campaigners' capabilities and advertising savvy, the disposable incomes of those within one's potential donor network, and the ability of particular illnesses and particular bodies to elicit care from others. And as health-related crowdfunding grows, and it appears to be on the up, the little understood practice of crowdfund campaigning is what we're interested in and what we think we need to have some sort of handle on as it becomes an increasingly critical practice for matters of life and death. So, next slide. In the paper we currently, we recently was released publicly, we ask, how do campaigners secure crowdfunded healthcare? And health-related crowdfunding, we think, presents a unique opportunity to examine the pervasiveness of market values within different realms of care. And as Snyder notes, crowdfunded healthcare, through its very premise, positions healthcare as a good, properly governed by the norms of the marketplace rather than as a basic human entitlement. And we're examining health-related crowdfunding through situating the paper within literatures on the commodification of care, which I'll speak to briefly before getting onto some of the empirical material. Once overlooked, at least within the scholarly domain, as a private or as a so-called pre-political concern, there has been increased recognition of the social, political, and economic salience of care in recent decades. Crucial to that recognition has been the development of care ethics as a framework for understanding how interdependence and relations of responsibility structure social and political life. And within that care ethics literature, a distinct sub-concern, sub-literature is developed on the commodification of care, and we engage with that particular aspect of the care literature. Commodification processes profoundly shape, we would argue, how relations of care are organized, experienced, and understood. Services once deemed public, healthcare, education, childcare in particular contexts, have increasingly come to be run by for-profit entities with a reduced role for the state in care provision. And even where the state retains control over service provision, oftentimes the language and the goals of the market are informing the models of care and practices of care. So from the rise of commercial childcare through to home-based elderly care work, social scientists have examined the emergence of new marketplaces for care, as well as instances where existing, ostensibly non-market spheres like the home are transformed into marketized spaces. And such transitions or transformations rather in the understandings and structures of care provision have been the subject of a lot of critique within the scholarly domain, as you might imagine. And scholars have argued that commodified care exacerbates inequities in access to care, as individuals are conceptualized as free and equal economic agents overlooking historical injustices and social inequities that shape their ability to operate as market-oriented consumers. Scholars have also raised concerns about the ways that the responsibilization, which is the term we'll use a little bit in the paper, of individuals in determining their own programs of care may come to undermine more collective models of provision as the emphasis is shifted toward individual choice over broader collective concerns. Framed by these perspectives on the commodification of care, we think it's fair to say that examinations of commodified care have largely focused on the nature and the implications of the shift from unpaid to paid caring labour as one sort of manifestation of the commodification of care, with a consequent emphasis on caregiving practices and what it means to be giving care in the context of these commodified relations and contexts. Crowdfunding provides insight into caregiving relations, of course, but it also provides insight into what we think is a less understood dimension of commodified care, which is how market mechanisms and values reshape the skills and traits that are required in order to be taken care of, to sort of be deemed worthy of care, as opposed to giving care oneself. So we focus not on how care is given, an interesting topic of its own, but how crowdfunded care is secured by campaigners that act on behalf of a friend or a family member in need. The majority, 71% to be precise, of medical crowdfunding campaigns in Aotearoa are associated with illnesses rather than accidents, long-term disabilities or other health needs. It's partly due to the structure of public care provision through the ACC, for example. So it means that for the most part, people are seeking funds that are related to an illness that is not sufficiently covered or has ancillary costs associated with it that they cannot meet themselves adequately or is not publicly funded. Most campaigns are not organised directly or solely by the person who would be receiving those funds for their illness. Young people are slightly more likely to engage in their own campaigns through crowdfunding, and that might be because of digital competence. But for the most part, the overwhelming majority, over 80% from memory, are campaigns that are constructed and managed by a family member, a friend, or a third party acting on behalf of the funding recipient, usually a family member, sometimes a friend. As far as I know, there are no professional campaigners that people engage, which would be an interesting and scary twist to this whole thing. Yeah. In July 2019, we did 15 semi-structured interviews with people that were campaigning on Give a Little on behalf of a loved one related to a health cost that their loved one, or a health condition that their loved one had that they required some money for. Campaigners were raising money for a range of funding uses and across a range of illnesses and disabilities. The most common were for forms of cancer and different forms of neurological disease. I forget, it's not all that useful to think of it in percentage terms, given there were fairly low numbers of interviewees overall, but the vast majority of those interviewed were related to cancer or neurological disease. And they were seeking funding for a range of different purposes. At times they were for forms of treatment not covered through the public system, sort of alternative therapies and fairly standard therapies, and much of the time for ancillary costs. So not direct health related costs, but the costs associated with conducting one's life when your caregiver can no longer go to work and earn money in the way that they used to, that are kind of knock-on costs associated with having someone in the particular situation that they're in. So we did all transcription, thematic analysis, and we looked at their interview accounts alongside analysis of their campaign pages and used their campaign pages in the interviews to try to prompt conversation. And we tried to, I guess, compare them in a sense to get a sense of the continuities, the kind of active scripting of the caring recipient, and potentially any sort of disjunctures between the pages and the lived realities of campaigning. And in the time I've got today, I want to focus on some particular aspects of the findings, namely the themes of responsibility, the theme of engagement, and the theme of accountability. Almost all of our participants explained that their Give a Little campaigns were used to bridge the gap between state-funded care and the money required for particular treatments and associated costs. And those funds ranged from, as I said, non-publicly funded drugs to overseas treatments that are not available here in Aotearoa to subsidising living costs. So for many, they didn't feel like they necessarily had a choice in choosing to crowdfund, unlike the kind of market subjectivity of sort of freewheeling actors that engage voluntaristically in a marketized context. So these are people that felt subjectively that this was not a free choice of theirs. It was a necessity that was foisted upon them. There's one participant, Desiree, she explained that crowdfunding for an unfunded cancer drug for her husband, we just run out of options. It was our only chance to really try and buy some more time. Vanessa similarly thought that we always knew crowdfunding was going to be uncomfortable, but we don't have many other choices, so you kind of just have to roll with it. Through its use to fill public funding gaps, crowdfunding entails this responsibilization of funding recipients and their social networks to secure healthcare. And that responsibility was talked about in two main ways. First was a responsibility to the campaigner to effectively engage the crowd, a responsibility of the campaigner to effectively engage the crowd and compete for the crowd's attention and sympathy. And on the Give a Little platform, the template on which individuals construct their campaigns encourages campaigners to get people's attention with a brief title, to win donors over with a clear explanation, alluding to and kind of stoking, in a sense, the competition for attention and ultimately the money, the scarce funds out there of donors. Being able to engage the crowd is helped by a number of factors. First, by having good communication skills. Second, by the marketability of the ill person and their condition. And third, by the time capacity of the campaigner to engage with the platform. And I'll speak to the second and the third in a little bit more detail. So on the issue of marketability of one's illness and one's body, in effect, pushing beyond the immediate networks, social networks that a person has, and into the larger anonymous reaches of the crowd. And for the most kind of side note is, unless your campaign goes viral, mostly the people donating are people you know, through your family, your acquaintances, your friends, which I guess also runs counter to the common conception of crowdfunding as, you know, a crowd, an anonymous crowd of people that you don't necessarily know. So only the viral ones, in general terms, really access the crowd in the way that we stereotypically understand the crowd. So pushing beyond those networks that you have through your day-to-day life and into the anonymous reaches of the crowd means navigating a minefield of social biases about who deserves assistance and who does not. Campaigners work hard as a result to frame illness in a way that resonates with the perceived predilections of the crowd. And those framings kind of reflect back at us. We are the crowd. They're preempting our own particular biases and trying to reflect them back at us in the hope that it captures our attention. Crowdfunding campaigners have to demonstrate that the recipient deserves the financial support, and that applies both to the illness. Is this an illness deserving of support? And to the person. Is it a person or a family that is deserving of support? And that's often done in our own particular cultural context by describing the funding recipient as hardworking and community-minded. These are common tropes used. Many successful campaigners have emphasized that the funding recipient had become ill through no fault of their own, often explaining that in the context of illness where you clearly cannot induce the illness upon yourself, by almost going over backwards to demonstrate this is not our fault, this happened to us, we're worthy recipients, or as a result of bad luck. And that framing establishes the recipient as a subject of misfortune rather than someone engaging in forms of personal irresponsibility and therefore being ineligible for the sympathy of the crowd. And those criteria that I've been talking about of choice on the one hand and of responsibility on the other were seen by participants to affect which illnesses are most readily marketable in a crowdfunding context. While $90,000 was raised for a child with a rare form of cancer in just 3 weeks, a mother raising money for a child's anorexia nervosa treatment described the uphill battle of fundraising for a misunderstood and often stigmatized illness, raising just $3,000 in over 6 months. Now, turning to the issue of time capacity. Engagement with crowdfunding platforms was generally talked about as being burdensome by our participants, sapping people's time and energy at a time that's already, one might say, trying, to say the least, in one's life. As Michelle explained, your time and energy and efforts should be going into really having quality time together as a family rather than having to spend hours on end emailing, sending texts and that sort of thing to try to encourage them, crowdfunders, to support you. This responsibilization can undermine the capacity of campaigners to address the wider structural challenges that precipitate the need in the first place, and therefore perpetuating systems of devolved responsibility. One participant, Chelsea, had started a petition calling on the Minister for Health to further develop what she argued were inadequate treatment facilities for children with eating disorders in Aotearoa. And the link to that petition was embedded in her crowdfunding campaign page, and the crowdfunding was sourced to establish a fund to support her daughter's attendance at an overseas treatment centre. And this kind of action, one might argue, reflects an explicit critique of broader structures of care provision and a resistance to the kinds of devolved responsibility that are associated with crowdfunding platforms, countering some of the arguments of various scholars who frame that crowdfunding is inherently depoliticizing issues of access to care. But Chelsea explained that she was unable to commit sufficient time and energy to that cause, the petition, in the context of shortfalls in publicly available care and the demands of the crowdfunding platform and the kind of engagement with potential crowdfunders. So she said, when you're a parent already having to care and cope with a child being severely ill, that's a handful enough. You literally do not have the mental or physical time or energy to also fight for things that you should be entitled to, like the carer benefit. So throw poor treatment into the works as well, and you're struggling on 3 fronts. Hence, the petition has gone on the back burner, which actually really needs to go across to help the many other thousands of families affected by this. Even in instances where campaigners endeavour to address structural inadequacies in and through their campaigns, rather, momentum in achieving these wider changes can be overshadowed by the realities of immediate needs in taking care of and taking care for the funding recipient. The second aspect of responsibility is that came through the campaigners' accounts was their sense of responsibility, not only to the person in need, but a responsibility in remaining accountable to donors, to crowdfunders. Accountability was demonstrated through posting regular updates to prove legitimate use of funds to the crowdfunders. As Nancy expressed, there has to be accountability in everything. You're asking this of people, so I need to be accountable. And giving updates on it is a way of being accountable and going, hey, you know, this is it. The progress is this. We're getting this much closer. This perceived need to establish relations of accountability also poses difficulties in the face of evolving care needs, forcing some campaigners to negotiate disparities between their advertised use of funds and the changing realities of funding recipients' needs. So you might seek funding on the basis of a program of treatment that's well articulated to potential crowdfunders. They give you money, and then something changes, the treatment is not working in the way that it might, and you would like to use those funds for something else. How do you remain accountable to those people? Will they care? Maybe, maybe not, but there is a feeling that one must treat them as kind of investors that require updates, that require their permission in order to change what things their money has been kind of invested in. Partway through raising funds for a targeted cancer drug for her husband, Hone, interviewee Desiree learned that this drug would no longer work for him. She posted an update on the Give a Little page notifying donors and asking permission for the funds to be diverted to a naturopathic treatment plan. And of that process, she explained, making that post was really hard because we didn't know what was happening over that time. I was fine with the possibility that people would take their money back because it's much easier to donate to something when it's for something specific and you know what's going to happen with it, as opposed to our airy-fairy alternative therapies, which we wholeheartedly believe in. But yeah, that was really hard. A sense of accountability to donors creates this added layer of uncertainty due to the possibility that people might want their donation returned, as they've donated under the assumption that the funds are being used for a particular purpose that may no longer be suitable in the context of fluctuating care needs. As I've said, crowdfunding, we would argue, entails the responsibilization of the would-be funding recipient to secure healthcare. And this responsibility is generally taken up by a crowdfunding campaigner, usually a family member or close friend acting on behalf of that person in need. Campaigners become responsible for convincing the crowd to care about and ultimately take care of the funding recipient. And as we've discussed, this puts significant burdens on the time and the energy of these individuals. And as part of that responsibilization, many campaigners internalized a sense of duty in remaining accountable to their donors, and accountability that we think may exacerbate the demands of crowdfunding, but also reduce the flexibility in meeting evolving care demands. Meeting the demands of responsibility that befall campaigners is just one aspect of securing the crowd's care, of course. And in the full version of the paper, we also discuss the ways that campaigners discursively construct the would-be funding recipient as deserving of the crowd's donations. Like the story of Levi that began this talk, deservingness, and this is just a quick summary of that, I suppose, is typically conveyed through a recurring script that involves comments about, first, the would-be recipient's optimistic attitude in the face of tough but potentially surmountable prognoses. This is a common, I guess, trope. Two, the fact that the illness was not caused of a person's past behavior and thus they're not to blame. And three, the person's fidelity to hegemonic understandings of the good citizen subject, which often reflects and reinforces established social hierarchies of race and ethnicity, of beauty, and of any sort of hierarchy that we have. You can see it reflected in these as a kind of ghastly mirror onto society, one might say. On a more abstract level, the account that we're offering points to the growing importance of crowdfunding as a kind of frontier zone for the marketisation of social reproduction, wherein kind of all relations, social relations of care are sort of not immune from their incorporation into forms of market provision and ideology. Some of our participants, for example, remarked how crowdfunding gave them and their friends and family a way to show they cared. It was kind of infrastructure for alerting people to someone they know being sick that would not have happened otherwise. And maybe as a prompt for donation, or maybe just as a prompt to connect with that person in a non-monetary way. Some campaigns are successful, and we don't want to take that away from anyone. And no doubt the campaigners and the recipients are grateful for the existence of crowdfunding platforms and crowdfunders themselves. All of those, in some senses, are good things, and plenty of good stuff comes out of crowdfunding. At the same time, there are noticeable issues inherent to crowdfunding. Instead of access to care being mediated by citizenship and residency rights or needs assessment, access is deeply contingent on relations to the crowd. Building those relations depends, as I've said, on the skills of the campaigner, the traits of the recipient, and the caprice or the predilections of the crowd itself. The relations of care between recipient and campaigner are also recast from relations of kin or friendship that is built on familial responsibility and the like. Those relations become recast, overlain, and potentially complicated by the roles of recipient and campaigner, not father and daughter, brother and sister, but recipient and campaigner. These are different kinds of relationships. And the entrepreneurial imperative that exists within crowdfunding systems that one must conform to if you want to have a chance of success. Those are all kind of abstract things, I suppose, but on a more practical level, while it remains to be seen whether crowdfunded healthcare will erode public systems of provision or solidify as a kind of critical supplement to public forms of provision, the findings of our research speak to the need for expanded rather than reduced public cover for healthcare and welfare-related expenses. And while some scholars have called for tighter government regulation of crowdfunding, prioritising strengthened public healthcare and welfare provision would address, we think, gaps that necessitate this kind of use of the platforms in the first place. And while the subsidised national health system in Aotearoa is undeniably more comprehensive than it is in some national contexts, I suppose the US is always looming large in these discussions of crowdfunding, given the nature of its public healthcare system. There are inequities in care and gaps in provision that exist close to home. So as crowdfunding for health-related purposes continues to grow, the concerns that are articulated by our recipients and by us trying to interpret them and situate them will only become more pertinent in the years to come. And if you have any interest in or further interest in health-related crowdfunding, encourage you to look at Susan Wardell's ongoing project on crowdfunding, health-related crowdfunding in Aotearoa. But these are some more, let's say, digestible versions of what I talked about today. And we wrote a piece for the conversation when the paper came out, and there was some interest from Radio New Zealand as well. So these might be useful resources for other kinds of audiences. Thanks very much for listening.
We'll open up to questions. For people on Zoom, Barry, you're managing the chat, so if you could just pop the questions into the chat, that'd be great. Yeah, were there any questions? Yes.
Thank you. Such fascinating research. I know you said that the sample size of your interviews wasn't particularly big, but one thing I noticed was sort of the quotes you chose, they're all women. And I mean, obviously the kind of gender inequities around caring, why do you know? And I just wondered if you've noticed in this particular space that same imbalance in terms of, you know, gender and caring responsibilities.
I don't think it's something as well canvassed in the literature, and it's not something that we, maybe due to oversight, or maybe there was some sort of intentionality behind it, or maybe we've just chosen the female participants because they're particularly evocative and they're able to emotionally articulate things that maybe stereotypically males are less good at. But I would assume those kind of existing inequities in gendered caring roles, they just played out in this context as well. And it's a good point. I'd be interested in figuring out whether we've just locked in on some juicy female respondents quotes or not. But it's, I guess, it is always surprising, but nonetheless shouldn't be, how this thing just reproduces every existing form of social hierarchy and bias. And I guess it gives us pause that the digital infrastructure that increasingly envelops and is the kind of platform for social life is just the same in its outcomes as you know, the analog world as well. And for all the hype around the democratizing potential and the kind of social leveler that is the digital realm, we have this.
I was just thinking about the fact that there are lots of charities on Give a Little already as well. So you're not, I guess, as individual crowdfunders, people are just competing with other individual campaigners. They're also competing with charities who, and I work with a charity and we have a Give a Little page, and we don't promote it in quite the same way, but we still, you know, there is competition there, and I wondered if there's comparisons to be made or similarities within how that happens, and because it's the same with who deserve, you know, which conditions or which charities deserve funds. Yes,
I guess this is an individualization of that process, and the kind of emotional fallout associated with it is all the more acute when you are really fighting for your very existence and your validation as a human being that's worthy of support from the community. Takes on a particular inflection when it's you and your husband or wife that are doing that work, as opposed to a community group where there's an element of distance and kind of an anonymity to a degree. It'd be interesting to see whether the crowdfunders fund individuals and community groups, or whether they really are just drawn to the particular cases of individuals. And I believe Susan's project gets at talking to crowdfunders and asking what their crowdfunding habits have been. Do they fund multiple things across different domains, or is it really, for the most part, people that are just drawn into a particular case that might be through their family and friend networks, or because in the Levi Holly case, that once a campaign gets a bit of momentum, media catch on to it, and then it kind of, that cycle of virality, so to speak, kicks in. So it's a bit of a black box to me, but you know, there is finite money out there in the world.
Yeah, that's it. But I guess
Inevitably.
it's such an individualistic approach, I guess. Whereas if you're doing something or you're getting support from a charity, not necessarily a very big charity, even a small one, you're kind of pooling some resources there and getting support from other people. Whereas the people doing this are doing it, it's like, they're on their own.
Yeah.
And they're having to negotiate. So the reason I'm thinking about this is also what one of those quotes is talking about is negotiating the healthcare system, which is not easy.
Yes. So you're a person that's probably encountering the health system maybe for the first time in that particular way. And at the same time, you're learning how to become essentially your own marketing agency. And you can imagine the burdens that would place on you. And there are some people, even that we interviewed, are more at home with online context, social media, that they might have had a background in, maybe not copy editing and copywriting, but at least they're used to producing text and trying to engage their communication skills in those ways. And for others, you could imagine how much of an imposition it would be on you.
And pretty scary in terms of success or failure and what
Yes.
that means.
Yeah.
Yes. Yeah.
Presumably there are campaigns that just drop, and that's pretty.
I couldn't tell you the percentage, but I would think that there are a lot. And we didn't talk to any people from campaigns that didn't raise any funds or that raised below a certain amount. We in effect wanted to talk to people with campaigns that were at least seemingly successful in generating some funds beyond an incidental amount, partly because we felt that the people who had already had unsuccessful campaigns didn't need us knocking on the door, taking up their time. So nonetheless, it would have been interesting to see the perspective of those that are potentially in the majority, or at least a substantial portion, where this whole process has been a massive time suck, as they say, for no real gain whatsoever.
I just wondered, the given all the crowdfunding constructions in general, it's entirely a blank slate. Like I could set up a campaign to get the sky renamed purple or something, and it's entirely down to my ability to make that sound appealing project. There's no regulation of any kind.
Not that I'm aware of.
Not on Given, it's not really a crowdfunding site, is it? It's a giving donation site. So I think if you're raising money for a business, there's a lot more regulation, right, for that kind of crowdfunding.
Yes, I think crowdfunding incorporates a bunch of different things. There is donations-based crowdfunding, there's equity-based crowdfunding, and there's a couple of other ones from memory. And equity-based is, I don't know, I want to start up this business, it's going to be great, do you want to invest in it? I'll give you a share of the business's earnings. Donations is sort of out of your goodwill, but there are plenty of, let's say, sort of jocular spoof campaigns almost that do ask for donations that are about, I can't even remember them, but there's some very sort of amusing ones that offer a nice counterpoint to the more serious aspect of my talk. But the page itself, or the platform, is a blank slate, as you say. They do offer you sort of bits of advice about how you might construct it, and there is a kind of pedagogic dimension to Give a Little and to other pages, but I don't think there's a sort of a teaching program associated with how to construct a good campaign and those kind of things. But if you want to start that campaign to paint the sky purple, I think this is the place for you.
But it's not free, right?
This is free, as far as I know.
Do the recipients get 100% of that?
I believe so. I think the system is you can, as a crowdfunder, you can donate to Give a Little in addition to what you would donate to the recipient. The GoFundMe does, I believe, take a cut of certain types of campaigns, and they may have a different arrangement for the medical related campaigns. Give a Little is funded through the Spark Foundation, an entity I know little of, but they're kind of enabled through philanthropic funds that make it, that take the element of profit away from this particular platform in a way that in other contexts it's very much part of the critique that one might have of how these operate.
But they do still charge operating costs, don't they?
They've changed, I believe.
Because I know certainly, you know, some of the people I work with on their campaigns kind of, they do it, they go give a little yes, and it's, you know, in terms of it being a useful platform and kind of, you know, focus point when you are trying to raise money to something, but then they tend to also say, hey, here's the just bank account if you want to not if you want absolutely every cent of it to go straight into the campaign, then just put it, here's my bank account. And then, you know, sort of social media, so they've got the kind of two streams of marketing, as it were, going. So I'm not ready to give it all rules, but that would be that was my understanding.
I thought the health campaigns were treated potentially differently, and that would be a wise public relations move on their part, not profiting from people that may be countering life-threatening illnesses.
Any other questions? Okay.
Yeah, it's interesting to say that the people doing the crowdfunding are people who know the person in need. Do you think there's like a marketing reason behind that? It's you're going to get more money because I'm asking you to give to this other person rather than I'm asking you to give to me. So I asked another question as well. We're doing in the interviews. Did anyone mention what the views of the patient was more or less about the campaign? Because they're off to the side a little bit. With the structure of it.
The question about the kind of proximate relations that people have being the primary donors, it seems to be human nature on some level that we're more willing to donate to those that we have relationships with. And I'm sure there are some evolutionary psychologists over there that will bear this out, that it's part of, you know, some sort of deep down human trait that we have. And once you get beyond those, then it becomes quite a big battle for scarce funds and attention, because if you're part of one's church group or something like that, then at least there are kind of reasons for you to be engaged and to care about their situation. But beyond your networks, then it's really down to the media picking it up, inserting it into their cycles, and then it kicks off on its own. So of the 15 campaigns that we looked at, I think only a couple of them got to the kind of amount where clearly this person's personal network could not generate well, maybe I just don't have the imagination of the networks that some people do, that it would seem that they did transcend that sort of proximate network and into what I would think the crowd properly is. Second question.
Oh yeah, so anyone you interviewed today actually talked about what the patient view, what their views were about the crowdfunding campaign?
Not a great deal, and maybe that was partly our questions, because we were trying in as best a way we could to not really stir up a conversation that could be quite confronting or emotional for the campaigner. So we more stuck to questions that were to do with how they engaged the campaign, what that was like. But inevitably, the comments kind of touch upon this spectral entity, which is the person that receives the funds. And in some of the quotes you see them more talking in terms of our experience being sort of a fund recipient and the campaigner, and grouping them into it being a burdensome process. But they did also mention how it was useful to not have the person in need of funds being the campaigner, that the campaigner as a third party or a second party, whichever way you might look at it, provided a bit of a firewall between some of the emotionally burdensome aspects of, in effect, asking people to value your existence would be quite a confronting thing for anyone. So there seemed to be some utility in not having them be the campaigner. But it was intriguing to hear as part of Susan Waddell's research that young people are sort of more inclined to run these campaigns themselves. And maybe that's because young people might not be asking for treatment for life-threatening illnesses. It might be more a sort of non-life threatening but still serious illness, and maybe because they're socially sort of encultured into engaging rather on a personal level with social media and the more anonymous and less personalized connections that people have. But I'm sort of in my mid-30s now, and I'm treading into old guy territory where I don't really know what that would entail.
Yeah, I was kind of wondering that myself, like how many of them were their own campaigners rather than, but so it seems to be more common that it is someone else campaigning in general.
82%, I
Right,
think, in
yeah.
New Zealand campaign are not their own. The person that would receive the funds does not conduct the campaign. So
Yeah.
it's still 1 in 5, which is significant enough, and more for younger campaigners.
Is there ever a kind of, could you get a sense of whether, because you alluded to this, just the fact that the relationship changes between, the campaigner and the recipient. How can they get quite, like create some sort of breakdown of relationship as well, in terms of like who ultimately determines where that money is going as well? Yeah.
And how the person's portrayed. right?
Yes. Yeah.
Like someone else is portraying you on social media, and you don't have much control over
And
that.
someone else is really constructing you
Yeah.
as a valuable recipient.
Yeah.
That must be
It must be really
really
weird.
strange.
Yeah.
Yeah, these unfortunately were not things that came up in. I believe we would have asked questions that would try to draw those things out, but they didn't come up in the interviews that we had. Susan, I believe, is drilling down into that on a deeper level. But you'd imagine it would be extremely confronting to have someone sum up your worth at a time where you need
weirder than someone you don't know.
Yeah.
So you kind of like see how they view you in a whole different light.
Yeah, I mean, I'm being slightly glib, but when you see how people are summed up, it really gives you pause for thought about, oh geez, what would my redeeming quality be? It's quite confronting, the kind of boiling down of human
life.
life.
Worthy of $125,000.
Right. Yeah.
Experimental budget.
Happy with $100, I think.
It is slightly weird though, when you read them, how a lot of them are almost like, I don't know how to really describe it, like pre-eulogies.
Yeah, like tribute.
Yeah.
Mm.
Exactly.
Tribute marketing.
Yeah, like you could imagine if this is the sort of thing, that if this sort of fails, they'll be saying, like, what a great family guy, upstanding citizen, member of the community, such bad luck.
What gets into the papers as well.
Yeah.
Those sorts of stories, absolutely, they're all wonderful.
Which is a whole sort of other level of weirdness in terms
Yeah.
of, someone else expressing their views of you and you say constructing you. But yeah, like kind of reading your own eulogy.
Yeah, I don't think that's jarring.
Yeah, and one of the few differences is often a kind of optimistic, what's the right term? Redemption story would be incorrect. It's a surmountable, it's a narrative about, we can get over this, we can push through this, things will be better if you're able to help us out.
The things we will do.
So are there any that are geared to, I mean, have you seen any that are geared towards just providing end of life care? Like this person's going to die and we're campaigning to provide a better.
Not in our sample of interviewees, but in the literature, they talk about the difficulty of marketing for cases where there is no
because the need is just as great
scenario.
Oh yeah,
Exactly.
well, is it to society, is prolonging or saving someone's life more important than providing and good care for someone?
It always is, because people don't want to talk about palliative care.
No, but
they
we're not
love
going to
the
die.
They're overcoming it. And
Yeah.
that brilliant before and after shots, when people are jaundiced and sick and really ill, and then they're frolicking in the meadows. Like,
Yeah.
that's what people want, that very A to B narrative.
Yeah.
Well, it's also just in the wording of it, and in your title, just like the marketing illness.
Yeah.
Whereas a lot of other crowdfunding, of course, Kickstarter and things like that, is for a product. In this case, the product is someone surviving, and if you're marketing end of life care, it's the product is the end product is not as easily seen as a,
But New Zealand
Okay.
obviously do care about end
Yeah.
of life care now, because they
yeah,
would be.
With the
people
milk
know,
food.
but it's the caring about the care rather than the end of life,
Yeah.
which is sort of the
Yeah.
end product in a way, which is kind of, I guess it makes it harder
Yeah.
to actually to talk up. But
Mm.
similarly, as long as you have a campaigner who can give that, make
Yeah.
that sound.
Presume hospice or something. So.
Yeah.
Right.
Yeah.
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 I think so.
Were there any questions on the chat? Any other questions? Otherwise we'll wrap up. Thank you everyone for coming. Thank you, Tom, so
No
much
worries, my
for
pleasure. Thanks
for
for
the
all great
really
questions.
interesting-
Nice to be here.